Info for patient.
And this is what I've taught you guys.
Right.
It's an essential part, and you can't do a mastoid without myoplasty.
Right.
And the other message for beginners is that allow yourself enough time. I don't know how long you take to do mastoid. I've been doing mastoid for 30 years. I still allow myself about 3 to 4 hours to do a mastodectomy, because that's where your time comes into play. If you planned it for 2 hours, you'll perhaps say get away with mastodectomy and not do myoplasty. Essential.
Right.
Essential.
So there is also an online question that what are the disadvantage of white concomitoplasty?
I think the disadvantage of white myoplasty is aesthetic.
Right.
Some people complain, especially girls, and this is why now we talk about making small cavities, doing an end oral incision, and using a front to back approach in patients where there is a small cholesteatoma. You can have a small cavity, and then you can get away with smaller myoplasty. So the myoplasty is proportionate to the size of your mastoid cavity that you're creating.
Right. So do you do post-operative audiograms in these patients?
About 3 months.
About 3 months. Okay. So my next question is, sir, what is your follow-up routine?
After surgery, I leave the packs in for about 2.5 weeks. They pack. After I remove the pack, I see them after 2 weeks. After 2 weeks, I see them at 3 months. And after that, usually about 4 to 6 months.
4 to 6 months. Okay. So what is the long-term follow-up?
I think patients keep coming for years and years.
For years. So my second last question is, sir, suppose if we do the MRM and after 6 months patient came with discharging cavity, what you do? What is your planning?
Is your patient or somebody else's patient?
Any patients. So he had MRM.
Yes.
So he has discharging cavity.
You have to very meticulously clean the cavity, make an evaluation. Is it just a discharging cavity? If it's just a discharging cavity and there is no cholesteatoma, then you can manage it in meticulous cleaning. I use silver nitrate to cauterize the granulations in the cavity, and you can do 2-3 sittings after week 10 days interval. If it's no recurrent cholesteatoma, you can get good results.
Right.
But if you see there is a recurrent cholesteatoma somewhere, you have to go back and revise it.
Right. So any question from residents? We have very good opportunity.
Graft the cavity, and in which cases is grafting the cavity